सो अगर नीट में अच्छी रैंक नहीं आई तो ड्रॉप लेना चाहिए और इस कीप अ रिजर्व और अ बैकअप ऑप्शन. आई रियली डोंट सी एनीबडी पिकिंग डेंटिस्ट्री एज their first choice. Everybody has teeth, everybody has to see a dentist. Jobs in any field are saturated. The maxillofacial surgery, orthodontics and prosthodontics is very advanced kind of work. आप कोई भी डिग्री लेकर अपने दीवार पर टांग दो, if you're not good at something, period. सो अगर नीट में अच्छी रैंक नहीं आई तो ड्रॉप लेना चाहिए और अगले साल फिर से प्रिपेयर करना चाहिए. There's a lot of people are asking me that, if you've not made the cut, should you take a drop, prepare again properly and give it again better next time. Honestly, is my personal opinion. I am really not pro drop. I've never taken a drop in my life. I don't really recommend that to anyone. Reason being is a simple logic कि when you add too much stake to your activity, आप बहुत ज़्यादा प्रेशर डाल रहे हैं. Everything is at stake. आपने सब हटा के एक चीज़ पर 100% आप कर रहे हैं. You put all your eggs in that one basket. The whole journey is going to be very stressful because at every point of time आपको ये लगेगा कि यार ये मैंने अपना सब कुछ लगा दिया इसमें. एंड जब आपके पास फिर से अगर मान लो यू आर नॉट एबल टू क्रैक इट, इट इज़ वेरी हार्ड टू कोप विथ समथिंग लाइक दैट, इवन फॉर अ स्ट्रॉन्ग पर्सन. Why do you want to put yourself in that situation? Okay, generally in life, the strategy that works is to move forward and at the same time always keep a reserve or a backup option. This is what we do in everything, but we are not doing that when it comes to our career choices, because you feel कि आपका focus dilute हो जाएगा तो आप एक चीज 100% करना चाहते हो, नहीं तो वो crack नहीं होगा. It doesn't work like that. I personally feel that अगर जो भी आपने एक अटेम्प्ट दिया हुआ है या 2 अटेम्प्ट दिए हुए हैं, कंपटीशन तो कम होगा नहीं, सीट्स एक्सपोनेंशियली उतनी बढ़ेंगी नहीं, राइट, एंड अपॉर्चुनिटीज मुश्किल ही होती जाएंगी, पॉपुलेशन भी बढ़ रही है एंड देयर आर लॉट ऑफ अदर इश्यूज दैट आर कमिंग. सो यू आर नॉट गोइंग टू बी इन अ बेटर सिचुएशन. सो इट मे जस्ट बी दैट योर बेटर प्रिपरेशन विल लैंड यू एट द सेम लेवल वेर यू आर नेक्स्ट ईयर, विच इज इक्वलेंट टू द इन्फ्लेशन विच हैपन्स विद एवरीवन, राइट. So why you want to put yourself in that situation? Is that career really that important for you and your family? I would say that आपके पास अभी, with your current rank, with your current score, what are the other available options? If you have BDS, if you have physiotherapy, if you have an allied healthcare science, I would say take it. And the reason why I say take it is because it will keep your career progressing, and these are healthcare fields. इसमें जो पढ़ाई करोगे वही आपके नीट के लिए पढ़ाई होगी, बल्कि उससे एडवांस पढ़ाई होगी, which will help you continue your studies as well. And generally the first year of most fields are not very hectic or stressful. First year of BDS, first year of physiotherapy, first year of any Ayush field is not going to be so strict and so hectic for you. In fact, you may have a better library access, better access to books. You can still continue your preparation. आप अपने पढ़ाई भी कर सकते हैं, ऊपर से आपका करियर भी प्रोग्रेस होगा. एंड वर्स्ट केस, अगर आप अपने पढ़ाई में ज़्यादा फोकस कर रहे हैं और जिस कोर्स को आपने लिया है उसमें भी अगर मान लो आपकी बैक लगती है तो उतना बड़ा प्रॉब्लम नहीं. आप वैसे भी यहाँ बैक लेने को तैयार थे, कम से कम आपने एक सीट लेके करियर प्रोग्रेस करके बैक ली. सो देयर आर वेरियस वेज to look at it, but I would say that take up these fields. Especially, I don't know, dentistry के related इतना stigma क्यों बनाया हुआ है. I really don't see anybody picking dentistry as their first choice. Why is it that if you're not able to get into MBBS only, you're going for dentistry? Dentistry is such a lucrative field. Somebody has really wrongly spread this information that there is no scope in future in dentistry. That is an absolutely wrong answer. Think about it. Everybody has teeth, everybody has to see a dentist, and dental care cannot be done on your own. To some point you can. एक बार caries cavities बन गए, root canal आप अपने आप नहीं कर सकते. It is a procedure oriented field that you have to go and get dental care. We are 1.4 billion people, guys. We don't have 1.4 billion dentists. There is still a huge shortage of doctors, huge shortage of dentists, and we are moving into an environment where convenience is important, proximity is important. आपके घर में खाना आता है, आपके घर में लैब टेस्ट आता है, आपके घर में ग्रोसरी आती है. कोई दूर का बेस्ट डॉक्टर ढूंढने नहीं जाता जो पहले के 10-20 साल पहले ऐसा होता था. अभी जो मोस्ट क्लोजेस्ट एक्सेसिबल है, they want to go and get their work done. So there is a huge scope for dentistry, but remember here I am talking about any field, whether it's dentistry, physiotherapy, Ayush, or even MBBS, or even postgraduate doctors. If you are going to look for a job, you are always going to find it hard to get a job. Jobs in any field are saturated. Do not link that to a particular field. Jobs by definition are way lesser than our population in any field, in any domain. अगर आप MBBS करने के बाद भी नौकरी ढूंढोगे, एम्प्लॉय बनने की कोशिश करोगे, डेंटिस्ट्री करने के बाद भी अगर आप नौकरी ढूंढोगे एक कॉलेज में, तो आप स्ट्रगल करोगे क्योंकि वो एरिया सैचुरेटेड हैं. बट डॉक्टर्स, चार्टर्ड अकाउंटेंट्स, लॉयर्स आर इंडिपेंडेंट फील्ड्स. वी आर इंडिपेंडेंट कंसल्टिंग प्रोफेशंस. You do not in today's day and age need that infrastructure. You can outsource that infrastructure. You can access it. I can open a clinic. I can operate in 10 hospitals. जब पेशेंट लेके हॉस्पिटल जाओगे, कोई हॉस्पिटल मना नहीं करेगा कि हमारे ओटी फैसिलिटीज यूज करने आ रहा है. आप विजिटिंग कंसल्टेंट तुरंत बन जाओगे अगर आप पेशेंट वहां लेके जा रहे हो. और पेशेंट अगर आप अपनी प्राइवेट प्रैक्टिस में लोगे तो वो पेशेंट का ट्रीटमेंट आपके लिए फैसिलिटीज मिल जाएंगी. बहुत सारे नर्सिंग होम्स, इन्वेस्टिगेशन लैब्स, all of these places are available. It's not like olden days where you did not have access to tools, you did not have access to infrastructure, you were forced to work in larger hospitals. Now you don't need to do that. 5,000 10,000 का अगर आप एक कैबिन लेते हो और उसमें थोड़ा सा इंफ्रास्ट्रक्चर डालते हो, 2-3 months you are practicing well and you're a good doctor, you will have people come there and you will do your practice and you will grow your practice and your career. That's as simple as it is to be a doctor or a dentist or anyone that you feel, whichever field it is, physiotherapy, whatever. I'm not saying dentists are not doctors. I'm just saying that I want to change, I want to bracket them as a specialist field जहाँ पर there is scope in it. Many people say कि हमें नीट में मतलब BDS मिल रहा, मैं ले लूँ. मैं बोल रहा हूँ ले लो, मैंने किसी को मना नहीं किया. बोलो you should definitely take BDS, because even after doing BDS, if you do masters in orthodontics or prosthodontics or maxillofacial surgery, after doing that you can still get into MCH, plastic surgery. You can still get back into mainstream surgeries, and maxillofacial surgery, orthodontics and prosthodontics is very advanced kind of work that can fetch you a lot of money, as well as you'll be able to treat and improve the lives of a lot of patients. And even if you've just done basic dentistry, you can be a cosmetic dentologist, you can start your own clinic, you can work with a senior doctor, learn the tricks of the trade and do it. But one thing is very important, you need to be good at it. Okay, आप कोई भी डिग्री ले लो, कहीं से भी ले लो, और अगर आप उससे एक्सपेक्ट करोगे कि अब मैं जिंदगी भर माला माल बनूंगा, दैट इज द बिगेस्ट false assumption that you have about everything. You have to be good at your field. That is what is going to make you progress. And if you are good in any field that you choose, you will progress in that field. There is nobody who is good at something, skilled at something, who is suffering and struggling today. It is only those who are not good at something, not able to fight with the competition, who are crying and saying यार saturated है, इसमें कोई फ्यूचर नहीं है. क्योंकि उनके पास नहीं आ रहे लोग, क्योंकि उनका साथ पेशेंट्स के एक्सपीरियंस अच्छे नहीं हुए हैं, उनके रिजल्ट्स प्रॉब्ली अच्छे नहीं आए हैं, तो उस वजह से लोग उनके पास नहीं आते हैं. राइट? सो दैट इज अ वेरी बेसिक थिंग. आप कोई भी डिग्री लेकर अपने दीवार पर टांग दो, इफ यू आर नॉट गुड एट समथिंग, पीरियड, anything, I'm not even saying about healthcare, any field, you have to be good at what you're trying to do, right? So if you're not good at it, you have to change the field. You have to find out what you're good at and grow your career in that, and that is fine. Maybe you might realize कि यार ये फील्ड लेके मेरे को पता चल रहा है कि मेरा कुछ है ही नहीं इसमें, मतलब अंदर से आई एम नॉट गेटिंग द स्किल, आई एम नॉट एबल टू गेट गुड रिजल्ट्स. व्हाट्स अ पॉइंट कंटिन्यूइंग इट? नौकरी लेके, सैलरी लेके बैठोगे विदाउट डूइंग एनीथिंग गुड is very difficult to get into, and that's where saturation mindset comes. All right, so pick the field, try to find where you're good at it, grow in that field. Don't follow what other people say. Other people may be good at other things, you are good at other things. Find out what you are good at. At the end of the day, when what you are good at only, you are going to grow in, not what your friend said or your colleague said or your uncle said or I said or anybody said, right? At the end of the day matters what you're good at. So you pick a field. You wanted to be a doctor, you want to make people's lives better, pick any healthcare field and progress with your career and start growing at it. If you want to keep preparing for your other exams parallelly, do it. It's the same education. Everything that you're studying for your entrance exams is what you're going to be studying in greater detail in these fields. कुछ अलग चीज नहीं है, कोई डिस्ट्रैक्शन नहीं है, ठीक है? बल्कि आपको और क्लिनिकल एंगल मिलेगा. आजकल सब टेस्ट क्लिनिकल हो रहे हैं, राइट? सो आपको बेसिकली क्लिनिकल एक्सेस मिलेगा. यू विल बी एबल टू सी पेशेंट्स, यू विल बी एबल टू अंडरस्टैंड अ लॉट ऑफ क्लिनिकल एंगल विद इट. सो गाइज, as far as possible, avoid a drop. But if you must, it's your choice. But I would say take what you're getting, find out what you're good at, grow in it. There are always ways for you to channelize your career to your interests going forward. So hope you take this advice and move forward with something rather than putting too much pressure and too much stake on your one decision that will be hard to cope with if it doesn't work your way. ठीक है गाइस, ऑल द बेस्ट, टेक केयर, बाय बाय।